ice massage is helpful if you have point-specific pain. If you can take one finger and poke around and find a place that's sore. This is specifically over a bony area. So if we look at the picture here, hopefully you can see there are a lot of muscles that attach around the knee. So it goes from muscle to tendon to bone, the way that it attaches to the bone. So the specific areas we're talking about, one is on the inside edge of the knee, and it's down here. You have 4 different muscles that attach there. If a muscle is too tight and it's yanking on its bony attachment, it can irritate the tendon. So that's one of the places that we may feel point-specific pain. The other is the top of the kneecap, the other is just below the kneecap, and one is over here on the outside edge of the knee. You can kind of see it better on this one, the outside edge of the knee where the IT band comes down and attaches. So if we're looking at the knee model, this is a right knee, and the places that you're most likely to find point-specific pain that can be helped with a 5-minute ice massage. The first one I talked about is on the inside edge of the knee. So if this were my knee here, it would be below the kneecap, kind of on the flat surface here. You can see where the kneecap comes down, then there's the kind of bump, bony part below the kneecap, and then just off to the middle is kind of a flat surface. That is where 4 different muscles attach. And when those muscles are too tight and being yanked on their bony attachment, they can irritate the tendons there. There's also a little fluid-filled sac called a bursa that can get irritated there as well. It responds really, really well to a 5-minute ice massage. So that's one place that you could do it. So really poke around and see if on that flat edge, there just to the inside edge of the knee, below the kneecap, off to the middle, if that's sore. The other place would be below the kneecap. So, the kneecap sits inside this tendon, so where the big quad muscle comes down and attaches to the top edge of the kneecap, and then the kneecap is kind of sitting in that tendon. A lot of times you'll get soreness either at the top edge of the kneecap or just below the kneecap, or where that tendon comes down and attaches to the bone right there on that bony part of the front of almost your shin down there below the knee, below the kneecap. So it could be one of those 2 places, the tendon above or below the kneecap. And the final place is over here on the outside edge. That's where the IT band comes down along the outside edge of your thigh and attaches on the outside edge of your knee. So this, when you're looking at the model, it's not this ligament here. The IT band actually comes here along the side, and where it's generally sore is right here. On my knee, if I'm pushing kind of ceiling to floor back and forth across that area, you may feel it's almost like a rope. It's like a band. If it's really, really tight, you'll feel your finger kind of bump back and forth across that band right there. That's the IT band. And where it attaches to the bone, sometimes that can get really inflamed and sore. So that's another good spot to do an ice massage. So when we're going to do this ice massage, the whole reason for doing it is to find the most tender spot, and we're trying to decrease the inflammation at that spot. So I have a couple of cups here that I've put in the freezer. So just a styrofoam cup, I filled it with water, stuck it in the freezer, and then when you're ready to use it, you want to tear off the top edge of the styrofoam cup. So just to expose about an inch of ice. And a styrofoam cup, please use a styrofoam cup and not one of those red Solo cups. As the ice melts, if you have that really sharp plastic edge of a cup, you'll end up cutting your skin with it without realizing it. So please, please don't use a plastic cup to do this. A styrofoam cup is perfect, but you just want to tear off enough of the styrofoam that you have ice exposed all the way around. And then you're going to take the flat surface of the ice and go back to the spot that you found that was sore. So if I was wanting to to do this on the edge where my IT band attaches. Maybe that was sore for me. I would take this and put it directly on the skin and do little bitty circles like that for 5 minutes. Now, I am not pushing hard down onto my skin. It's just barely touching my skin, but little bitty circles for 5 minutes. You can see a drop of water just during a couple of seconds I had that there. A drop of water already ran down my leg. So the way that I prefer to do it, this is another one I found in my freezer, is I usually put it in a Ziploc plastic bag so that I don't have water flowing all over the place. And it works just as well. It's just a little neater. So this is one, obviously I've used a few times compared to the other one. But you have the flat surface of the ice, and that just goes directly on your skin. In little bitty circles, you have to keep it moving the whole 5 minutes. You don't have to push hard, but you do have to keep it moving. Now, the other thing with this, if I had two areas that were sore, so let's say the attachment of my IT band was sore, and this top edge of my kneecap where my quad muscle attaches into the kneecap, maybe that's sore too. Even though those two places are pretty close together, I mean, we're talking here and here, they're still not close enough for me to do a 5-minute ice massage that will touch both of them, because you have to be touching that same spot the whole time. So I would have to do, for these two spots, I would have to do 5 minutes here and then come and do 5 minutes here on the other spot. As far as the frequency of doing this, it's best if you can do it right after you've done an activity that has caused soreness or pain in that area. You can also do it just before you go to bed. It's really the same as how you would use a cold pack if you had a sore joint, like a shoulder joint or knee joint or something. Just however you would normally use a cold pack. It's the same thing, but because this is point-specific pain, it's over a bony area, a 5-minute ice massage is much more effective. So good luck. I hope you are able to get some styrofoam cups in the freezer pretty quick, because this is something I always keep in my freezer. You never know when you might need it. So good luck.